Carrie McCrimmon, Associate Director for Human Resources. You guys know me already, so I won't go any further than that. Joe Manini is with us from Emeriti. He's been here for 5 years, coming every year faithfully. Only Joe and only Joe.
For snow and sleet.
Exactly. To do our presentations, and we're really happy to have him here again. And he'll be talking with you all about Emeriti and its broad range of benefit that it offers for you. So I'm going to go ahead and turn it over to Joe, and here we go.
Thanks, Karen. Thanks, everybody. Thanks, everybody, for coming. Don't mind if I stand right here. Yeah. So as Carrie said, my name is Joe Manini. I'm the Director of Marketing at Emeriti, and we come out each year on campus to do these presentations. And the other presentations today were geared a little towards getting ready to retire, as I mentioned, and those folks that are earlier in their careers and why you need to save. Those were what we call mini tutorials, so they were shorter. This is actually the retiree session, and it is a full hour session where we go into a little more depth about Medicare, what's changes may have taken place, and what insurance plans are available for 2012 and how they may have changed from last year. So with that in mind, I know both of you are not enrolled in the plan currently, right? So, and if you're thinking a year or two down the line, this session should still be good for you as well. So kind of talked about that. One of the big changes in Emeriti is who's providing the services in the program. Have either of you sat in on a workshop session in the past, or?
Yeah.
Yes, you both have. Okay. If you did, then you remember that Fidelity was doing all of our record keeping, trust administration, and investment management, as well as some disbursements of insurance premium, and they currently are providing that service through the end of this year. Starting in January of 2012, we're moving to new service providers, and we're splitting up the process that Fidelity provided throughout the years into two organizations. TIA-CREF will be handling the accumulation record keeping. So if you're receiving employer contributions at all, you may have received some in the past, they will be doing all the record keeping for that. Trust services are provided through TIA-CREF, as well as investment management. So all of the dollars that the university may be putting in on your behalf, or if you've made any contributions into these accounts on a voluntary basis, will be migrated over to the TIA-CREF life cycle funds. So just to give you a heads up, the way that's going to work is at the end of this year, any dollars that you have in the Fidelity life cycle funds or the money market accounts will migrate over to very similar TIA-CREF accounts. So whatever life cycle fund you may be in Fidelity will migrate to the TIA-CREF, or if you were in a money market account, the same would hold true. So that's going to start at the end of this year. Basically, there'll be a blackout period from December 29th until no later than January 15th, where you won't be able to see or move around any dollars during that period of transition. And then after that, you'll be free to move within the Fidelity or the TIA-CREF life cycle funds, as well as the money market account. So what's going to happen is at the end of this year, 2011, Fidelity will send you a statement that you'll be receiving the beginning of next year, basically a year-end statement that's going to show a zero balance, and it'll show any dollars you had in the accounts, what funds they were in, and that they've been transferred out over to TIA-CREF. And then the beginning of 2012, you'll receive a statement from TIA-CREF with a new opening balance, which essentially will be the funds that were transferred over from Fidelity. If you are directing your dollars into any other account other than the default life cycle funds, you'll need to reestablish that allocation. So if you haven't told Fidelity where you wanted dollars to go, and it was just defaulting into the appropriate age-appropriate life cycle fund, you don't need to do anything at that point. It'll just go over into that age-appropriate fund. We're also going to offer sometime in the second quarter of 2012 some additional funds other than the life cycle funds through TIAA-CREF and money market. There's going to be some additional proprietary mutual funds, meaning TIAA-CREF specific funds, as well as non-proprietary funds from other organizations that will be available on top of the life cycle funds for you to invest in if you choose to. Okay.
And how will we know about that in terms of what our options are?
There'll be communications that are going out. Yeah, so you'll be receiving some communication, whether it's through mail or internal communications. But we'll definitely keep you up to speed on when those funds are going to be available and which ones will be available. So that's the accumulation record keeping side. The other organization that we're going to use to provide services for is Savitz. And Savitz is an organization out of Philadelphia. They're a little over 40 years old, and they're a benefits consulting firm. They work both with active and retiree health insurance benefits. So Savitz will be providing the disbursement record keeping. So in other words, when you actually do retire, and if you utilize the insurance plans offered through the program, they're going to be the ones that are actually taking the funds from your trust account or your bank account if it's linked to your bank account, and sending them on to Aetna for payment of your insurance premiums. They'll also be handling the qualified medical expenses, so that reimbursement benefit that's associated with the program, that's like a flex spending account where you can reimburse yourself back for qualified medical expenses. Savitz will be adjudicating those claims and administrating that process, and you can continue to send in reimbursement forms manually through the mail or either fax them in. And sometime early next year, we're actually going to be rolling out a debit card, so you'll be able to use a debit card at point of purchase, assuming that you have funds in your account to pay for qualified medical expenses at point of purchase. So TIAA-CREF will be doing the accumulation record keeping, Savitz will be doing essentially the disbursement record keeping, and the insurance portion of the program hasn't changed at all. Aetna will be underwriting all of the plans that we offer in 48 states, and Health Partners, if you live in Minnesota, or from a school that was in Minnesota and lived in Minnesota, will be providing the coverages in Minnesota. So for all intentional purposes, Aetna will be providing your coverage.
Which is the state that doesn't provide? You named 48 plus.
Actually, I take that back. It used to be 48. It's Aetna was not able to offer insurance in New Mexico, but they currently can now. So it's 49. Yeah. Good catch. Somebody's listening. Okay, so Medicare. This isn't necessarily the Emeriti program, but what's actually happening with Medicare for 2012 and any changes that may be occurring. Medicare, if you're not familiar with it, it's made up of 4 parts: Medicare Part A, Part B, Part C, and Part D. A is your hospitalization, B is your medical coverage, D is your prescription drug coverage, and Part C is a Medicare Advantage plan that we're not going to discuss right at this moment. But Part A deductible, so your hospitalization is the deductible was $1,132 for 2011, and we actually have that information. It's going up to $1,156 for 2012. Part B, the monthly premium. So Part A, there is no premium associated with that at all because you've been paying for it with your FICA taxes each year while you're working. Part B, once you retire and enroll in Part B, Medicare Part B, there is a monthly premium associated with that, and typically that comes right out of your Social Security check. Part B premium for 2011 was $115.40 for new entrants, people that went in 2011. For people that were already in Medicare prior to that, the premium was $96.40. For 2012, we just learned that Medicare is going to have one uniform rate for everyone, and that rate will be $99.90. So those folks that were new to Medicare Part B last year, they'll actually see a slight reduction in their premium, and everyone else will see a small increase of $3.50. The Part B annual deductible, and again, Part B is your doctor's visits, and again, this is just Medicare and how Medicare works, has gone from $162 actually down to $140 for 2012. So that was good news there. Essentially, the decrease in Part B deductible was offset by the increase in Part A, almost dollar for dollar, so it's budget neutral, if you will. The Part D deductible, that's for your prescription drug coverage. That's going, sure.
I'm sorry to interrupt. What's the difference between Part B annual deductible and entrant premium? In other words, you've got now for 2012, the deductible is going to be $99 for all. Well, how is that significant? What does that signify in comparison to the annual deductible?
Right. The Part B, where it's going to be $99.90 for all, is the monthly premium that you pay. It's the actual premium. The deductible is going to go down to $140.
I can understand.
Yeah, so one is a deductible and one's a premium. Your Part D deductible, again for prescription drugs, is going to $320. Part D coverage gap, that's, and we'll talk about this a little more in a moment, where you reach that donut hole or coverage gap for prescription drug coverages, where you're responsible for 100% of the expenses, is going from $28.40 to $29.30. And then Part D, true out of pocket or TROOP, where that's your maximum out of pocket limit. Then you go into catastrophic coverage, and we'll see an example of that in a little while. That's going up to $4,700 for 2012. So this is just to give you an understanding and a little education on how Medicare Part D works. This is a Medicare Part D standard illustration. So just to give you an idea of how it works. And then our medical or prescription drug plans kind of coordinate with this type of coverage. So you can see here, you've got the $320 deductible, which is what we said for 2012. So on a standard Medicare Part D, you would be responsible for the first $320. Then you move into the initial coverage period. And what that means is there's going to be a cost share. Medicare is going to pay 75%, and you're going to pay 25%. Okay? And then once you've reached a total of this $2,930 between your deductible, the portion you pay, and the portion that Medicare pays, you move now into this coverage gap. Okay? And once you're in the coverage gap, you're actually responsible for 100% of the cost of the drugs that you're utilizing. The government for 2012 is going to provide a subsidy for generic brand prescription drugs in the gap or in the donut hole, and that subsidy is 14%. So you'd be responsible for generic coverage of 86%, and the government will provide a subsidy of 14%. Now, once your total out-of-pocket coverage reaches $4,700, that's true. So that would comprise of, this is out of your pocket, the $320, the $652.50, this $3727.50. That will put you at the $4,700, and now you're in the catastrophic protection coverage. And Medicare picks up 95% and you pick up 5%. Very confusing, and whoever came up with this, we'd have a few choice words for, but so this is how a standard Medicare plan works, okay? So some of the updates for healthcare reform and how they impact these plans, actually, starting in 2011 and which will carry over to 2012, there'll be a 50% discount for brand name drugs in the coverage gap or the donut hole provided by pharmaceutical companies. So as long as the pharmaceutical company is participating in this program, and most of them are, you will get this 50% discount at point of purchase if you have a brand name drug in that donut hole. And we already saw the generic drug discount that the government is providing of 14% in that donut hole. So there is a little bit of help with healthcare reform moving towards trying to close that gap or donut hole. So for 2012 now, we were talking about just Medicare before. So for 2012, the plans that Emeriti is offering that will be available, and this is a generic presentation, so not all of these plans are available in all 50 states. Unfortunately, Washington is one of the states that these Medicare or Medigap type plans are not available in 2012. We're hoping that by 2013 they will be, but currently they're not. So what is available from the menu of options to choose from? We've got one Medicare coordinated plan, which is 100% what they call COB, and we'll look at some more detail in a moment, but it's a very, very rich plan. And then the other is a Medicare Advantage type plan, PPO, which is a Medicare Part C plan, where you're actually assigning your Medicare Part A and B rights over to a private carrier. So those are the two medical plans that will be available to choose from in 2012. Then we'll have, for prescription drug coverage, 3 plans to offer a high, a mid, and a low plan. And we'll look at some details for each one of those plans in a moment. And then you'll also be able to add a dental plan if you'd like dental coverage in retirement. Typically, you don't see dental coverage added to retiree health plans, but it is available through the Emeriti program. So how do these plans coordinate with Medicare? As I mentioned, that first plan, the traditional choice plan, is 100% COP or coordination of benefit plan. There is a deductible with that associated with that plan of $200. It does have Part A and B deductibles covered by the plan deductible. So in other words, you only have to pay the plan deductible of $200 and not worry about those other Part A and B deductibles that we were talking about earlier. And essentially, once you've met your deductible of $200, this plan will pay 100% of all benefit eligible expenses, Medicare benefit eligible expenses. So it's a very, very rich, comprehensive plan. These plans, I won't go into great detail because they're really not available, but they're Medigap type plans, group Medigap plans, like an AARP Medigap type plan. And then this is the Medicare Advantage plan that's being offered. Again, it replaces original Medicare, so you're assigning your Part A and B over to a private insurer. In this case, through Emeriti, it's Aetna. There's a plan deductible, and you pay part of that Medicare A deductible and all of your Medicare Part B deductible. Okay. And there's some co-insurance involved as well with that plan.
It's not clear to me.
Sure.
This is the first time I've seen this. What's then the difference between the traditional and the Advantage PPO?
The Aetna traditional choice it coordinates with Medicare, so Medicare still pays primary, and then this plan will pay secondary and pick up essentially once you've met that $200 deductible, all of the portion that Medicare doesn't pick up. This plan here, you're assigning your rights Part A and B over to a private carrier in Aetna. They now become primary, so Medicare is out of the picture. They're not going to pay anything at all. And then, but there is some co-insurance involved with this. So there's some cost sharing, and there's an example of that. I think it might be on the next slide or the one after that, where we can walk through.
So what I'm trying to get at is which one costs more, and which one you'll get to that?
Yeah, the rate sheet you have in front of
The
you
next one.
right here.
Wait.
Yeah. So this is the traditional choice, and it's age banded, so depending on what age you are, that's the monthly premium. And then the PPO plan or Advantage plan is right here.
Gotcha. But that doesn't start until you're 70?
No, it's for all ages.
Yeah,
What
that's
is
all.
it?
That's community rated, so it's just one premium, right?
But there's a deductible for that,
Traditional choice.
not traditional.
The other plan, yes, there's also a deductible, and you'll see that right here on this slide. The Aetna Traditional Choice has that $200 deductible. Like I mentioned, once you satisfy the deductible, it pretty much pays 100% of everything that's Medicare eligible. If you had a situation where it didn't, there would be 20% co-insurance and a maximum out-of-pocket limit of $2,000 or $1,250. So what that means is if you ever reach that limit, the plan would pay 100%. You wouldn't have to pay anything else. K&L, you can just see here, there's no deductible for those plans. Medicare pays their portion, and there's co-insurance of your responsibility of 25 and 50%, and then you can see what the maximum out-of-pocket limits are for each one of these plans. The Medicare Advantage plan, again, where you're assigning your rights over, your A and B rights over to the carrier, there is a network associated with this plan. So for traditional choice, there is no network. So you can go to any physician or any facility who accepts Medicare. You don't need to stay within a defined network. For the Medicare Advantage plan, there is a in and out of network coverage. So if you stay in the network, your deductible is $300. Out of the network, it's $500. And then the co-insurance you can see is 15% for in-network and 25% out of that network. And then the corresponding out-of-pocket limits for in and out of network coverage. And again, the traditional choice is age banded, so that's 65 to 69, 70 to 74, and 75 plus, whereas the Aetna Medicare Advantage plan is what we call community rated, or one rate for any age. And I think I've got an example here. This will just give you an idea of how those plans coordinate with Medicare and how they pay out. So in this particular example, we're assuming that you go to the doctor and there's a $100 charge for the office visit, and you've already met your deductibles. So the deductibles have been paid for in all of the plans. So we have a $100 charge. Medicare typically pays 80% of medical charges. So under traditional choice, Medicare is going to pay their 80%. There's 20% left over. Aetna will look at that and basically pay the entire $20. So you pay nothing out of pocket after you met your deductible. Under these Medigap plans, $100 charge, again, Medicare pays 80%, and there's that 20% or $20 left over. And if you recall, this plan had a 25% co-insurance, so you pay 25% of that leftover $20 or $5, Aetna pays 15, and this plan was a 50% co-insurance. So that leftover $20, you pay 10, Aetna pays 10. Now with this plan, remember this is where you're assigning your rights over to a private carrier. So Medicare is now out of the picture. So they're not going to pay anything yet. So Aetna looks at this $100 charge, and in this particular example, it was an in-network charge, and there's 15% co-insurance, so 15% is your portion that you need to pay. So you pay $15 of the $100 charge, and Aetna pays $85. So that just gives you an illustration of how these plans coordinate with Medicare and how they pay out. Now for the prescription drug coverages, again, as I mentioned, we have a low, a mid, and a high plan. The low plan here is very similar in coverage to that example that I showed you before, a standard Medicare Part D plan. It's slightly richer than a standard plan. You've got a standard formulary, which means you have a more constricted or limited choice of pharmacies to choose from, pharmaceutical drugs to choose from. There's $320 deductible, which is what the deductible is for 2012, and then your initial retail co-insurance. So for that initial period, that first period that we were talking about before, after you satisfied your deductible, there's 15% and 30% co-insurance. And this is for generic drugs, and this would be for preferred brand drugs. So you would pay 15 or 30% cost share in that initial period. Once you hit that coverage gap, there is no coverage at all. So you would have no coverage other than that discount that the government's going to give you for the generic and that 50% discount from the pharmaceutical companies. Once you pass that coverage gap or donut hole, it reverts back to 95% coverage and you pay 5%. The mid-level plan now moves to an open formulary, so you have access to a wider array of drugs, of pharmaceuticals. It moves down from a $320 deductible to a $100 deductible, so your deductible is lower. And in that initial coverage retail cost or co-insurance, until you reach the donut hole or the gap, it's 15, 30, and 50. And so now we're adding coverage for non-preferred brand drugs as well. So generics, preferred, and non-preferred. And those are your cost, your co-insurance. If you did jump into the coverage gap or donut hole, with the mid-level plan, there is coverage for generics only. So here you have no coverage other than that discount by the government. Here you're going to pick up coverage for generic drugs only. Then once you pass through that coverage gap, again it goes back up to 95% cost share. The high plan is the richest medical benefit. Again, it utilizes an open formulary, $100 deductible. The co-insurances are 15, 30, and 40 for generic, preferred, and non-preferred drugs. But when you get to the coverage gap, you're going to have full coverage through that donut hole or coverage gap. So these co-insurance percentages will carry right through the coverage gap. Okay? And then once you've gone through that coverage gap and you've gone into that catastrophic coverage area, this plan actually pays 100%. So it's the richest of the plans we offer. Obviously, it's also the most expensive of the plans we offer. So depending on your prescription drug usage, if you're only on one or two maintenance drugs, this low formulary or low plan may be suitable for you. If you're someone who utilizes many prescription drugs, the high plan may be better suited for you. But again, you're going to be able to move between these plans from year to year. So,
So it's an annual, you're allowed an annual change?
Yep, exactly. Yeah, for both medical and prescription drug. Right. Yeah. Now, this is an example like we showed you with the medical plans, only using the prescription drug coverage of a $30 generic prescription being filled. If you have the low plan, you're in the donut hole, so it assumes you're in that donut hole or coverage gap. If you have the low plan, there is no coverage for generic anything in the coverage gap, but you're still going to receive that discount that the government is offering. So you would pay 86% of the cost of the prescription, or $25.80. The mid-level plan, if you remember, when you're in the coverage gap, there was coverage for generics only. So you're going to pay 15% or $450, and then the high plan, the same thing, there was a 15%, so you would pay $450. This example here is of a preferred brand drug of $100. Now, if you're in the low plan, there's no coverage again in the donut hole or in the coverage gap, but you're going to get that. You'll still receive that 50% manufacturer discount, assuming that they're participating. So you're actually going to pay $51.50, and the reason that it's not $50 is that we're assuming a $3 dispensing fee added to the $100. So you would get this 50% discount. You pay $51.50. The same thing with the mid plan. There's no coverage for preferred brand drugs in the coverage gap, but you would still get that 50% discount. And then finally, in the high plan, there is coverage that carries through the coverage gap, and the co-insurance for that would be 30%. So essentially, you're going to get your discount and then pay just the 30% of that. So that's how the plans pay out. The dental plan, it's a fairly standard dental plan that's offered through the program. It's 100% coverage, preventive coverage, with a $100 annual deductible for major services and basic services for both of these. And there's an annual benefit, maximum benefit of $1,500, and that's per calendar year. And these, again, are community rated, so it's just one rating. The couple of things here that you want to think about is the major services. If you have dental coverage currently and you switch to this plan, there is no waiting period for major services. If you're coming in and you don't have at least 12 continuous months of service prior to coming in, you would need to have a 12-month waiting period. Okay.
When you say annual benefit maximum, that $1,500 means what?
That's the maximum that the plan will pay out in a calendar year.
Gotcha.
Right, exactly, yeah. And dental can be added to a medical and RX combination. One of the things is when you do choose or you're ready to enroll in the insurance, you don't need to take the dental right away. So you don't have to take it the first year, the second year, you can wait. But once you do enroll in dental and add it to these combinations, if you disenroll, you can't go back in. So you can't jump in and out. So when can you access your health insurance? You first of all have to meet the eligibility requirement for retirement here at SBU, which is essentially age 60 with 7 years of service, or age 65 with 5 years of service. And once you've met that eligibility, then you would qualify to participate in the Emeriti insurance offerings, and that would happen, you have to be at least age 65. These are all post-65 plans. So you need to be at least age 65, retired, and then enrolled in Medicare Parts A and B. And then that would enable you to participate in the insurance portion of the program. Who can use the insurance? Obviously, you as the retiree can use the insurance. If you have a spouse, your spouse would be eligible once you enroll in the insurance offering to participate either in pre or post-65 plans we offer. Domestic coverage is not available. Dependent children, if you have a dependent child, they would be able to utilize the insurance before the age of maturity. Aetna now is following the lines of the new healthcare reform and actually allows children to stay on parents' policy up to their 26th birthday. So, and then permanently disabled children if they were disabled prior to age of majority. One other note here is that if you do have a spouse that's going to participate in the insurance, both you and your spouse have to be on the same medical and prescription drug combination. This slide just really depicts when you're thinking about insurance and which plans to choose, amongst other concerns, and if you're thinking about costs and out-of-pocket expenses. Do I want to pay a higher premium today for a plan that has lower deductibles and maybe low co-pays or co-insurance, or do I want to pay a lower premium today for a plan that has higher deductibles and higher co-pays? So amongst other decision factors, this is something you want to consider in that process. So what do you need to do when you've met the eligibility requirements and you're turned 65, retired, and enrolled in Medicare Parts A and B? You're going to choose a medical plan. You're going to select an RX plan. Think about whether or not you want to participate in the dental insurance, and then you can call the Emeriti 866 service number with the information to get that process started. What Emeriti also allows you to do is choose just the RX low plan on a standalone basis. So in other words, if you relatively healthy when you retire and you maybe only see the doctor once a year for a physical that's covered by Medicare, but you don't want to opt out of the Emeriti program, you can select just the RX Low plan, which is relatively inexpensive to keep your foot in the door or use it as a placeholder. And then each year during open enrollment, if your medical condition change or financial conditions change, you can move into a medical plan as well. And you can also add dental coverage to this plan on a standalone basis. So insurance choices that you have for 2012, being like you're not currently in here, you really don't need to worry about the default options, but basically you're going to choose one of the medical plans, one of the prescription drug plans, and then the dental plan. How are your premiums paid? Once you do enroll in the insurance offerings through the Emeriti program, in other words, the Aetna plans, the payments are actually paid through that trust account that has been established for you. So Savitz, as we said before, is a record keeper for disbursements. So essentially, Aetna is going to generate a bill for you. It will be sent to Savitz. Savitz will take a look at it, then take a look at the funds in this trust account. Assuming there's enough money in there, those funds will then be withdrawn and paid electronically to Aetna. If there aren't enough funds in the account, your account is going to be linked to a banking account of your choice, either a checking account or a savings account, and the shortfall will come out of that account. So if the bill is $300 and you have $200 in that trust account, they'll pull the $200 out of the trust account and $100 out of your banking account and send the $300 directly to Aetna. Now, one of the things that is changing this year with the transition from Fidelity to TIA-CREF is Fidelity couldn't transfer over any banking information on file. Being both of you are not enrolled as of yet, you'll just be, providing new banking information when you actually do the enrollment process. This we've already covered. So decision time, this first doesn't apply to any one of you. So here, if you are enrolling for the first time, what you'll need to have when you do call the 866 Emeriti number is you want to make sure you have your Medicare Parts A and B numbers, your Social Security number, date of birth of any eligible dependents that you may have, as well as their Social Security number, and then have ready the banking information for the account that you want to link to this account. So there, as I mentioned before, there is a reimbursement benefit associated with this program. And let me back up a second as far as when you actually do retire and turn 65, you're not obligated to use the plans, the medical plans through this program. You can go outside of the program and take another plan, say an AARP plan, but you need to make that decision pretty much as soon as you enroll in Medicare Parts A and B and have retired, because Aetna wants to avoid adverse selection, so they want everybody, whether they're healthy or sick, to choose a plan at that point. If you opt out and decide to choose an AARP plan, you can't come back in to the program. If you're covered under a spouse's plan, so maybe you're 67 and you retire and your spouse is 63 and still working, and you're covered under his or her plan, that is deemed credible coverage. When your spouse loses coverage, then you can actually come back into the Emeriti program. But if you opt out to go to another plan willingly, then you can't come back in. So there is that reimbursement benefit associated with the program, where essentially you can use the dollars that are in this account as a kind of like a flex spending account for retirees. So you'll be able to reimburse yourself back for any qualified medical expenses through this account. And you can also, in retirement, during your working years, you can make contributions on a voluntary basis into these accounts. They'd be after tax, grow tax-free, and come out tax-free. And even in retirement, you'll be able to make contributions through an ACH transfer. That process won't start until the middle part of next year, though, for the ACH transfer. So if you were retired and submitting claims, you would submit a clearance. The manual claims process, for those of you who will be enrolling currently, will start in January, utilizing Savitz's service, and you'll either mail or fax in the form. If you get a enrollment kit, that form should be in there. You can also download the form online from our website. And in spring of 2012, that's when that debit card option is going to become available. And just for your clarification, the debit card, when you're using either the debit card or the reimbursement benefit, the funds that you're going to need to utilize or have available will need to be in the money market, the TA-CREF money market account. So if you know you're going to be using that benefit, the reimbursement benefit, you probably want to transfer some dollars over to that account to cover those expenses from within the other funds that you're in. So a list of some of the things that you can use the reimbursement benefit for, and this is not a complete list, but remember I said that there's Medicare premiums associated with Part B. You can reimburse yourself back for those, that $99 or $100 premium. Any payments, co-insurance, vision, dental, hearing, over-the-counter medication, non-formulary medication. You will need a prescription drug or prescription from the doctor to get reimbursed for that. Long-term care insurance premiums, medical expenses associated with nursing homes, and other post or pre-65 insurance. And that's that example I said that if you opted out and maybe went to AARP, you can actually be reimbursed for the premium that you're paying them, assuming you have funds in the trust account.
But this obviously doesn't cover pre-65 COBRA.
Yes, you can reimburse. You can be reimbursed for pre-65 COBRA. Yes. Yeah. So who can use the reimbursement benefit? Essentially, this is the same list of individuals we had before, but now we've gone ahead and added dependent relatives. So maybe you're taking care of an elderly parent or elderly in-law, and they qualify as IRS dependent. So they're living in your household and they're economically dependent upon you for at least 50%. Any qualified medical expense that they incur, you can actually be reimbursed back for. And again, this is all assuming that there are dollars available in this account. It won't pull from your ACH transfer to pay a reimbursement. It will only do that for your insurance premiums. So the funds that are going to be available, we kind of touched on this at the beginning of the presentation. Initially, it's going to be the TA-CREF retirement class life cycle funds, as well as the retirement class money market fund, with other funds to be added in the second quarter of 2012. And this is just a listing of what the life cycle funds that will be available, and with the ticker representation. So if you're interested in doing any independent research to find out how some of these funds have done over the past years, you can just use that and maybe go on Morningstar or another site like that to do your research. So we've touched on most of this. We talked about the blackout period that's going to occur at the end of this year, so you won't not to be able to see or move any funds around until about the middle of January. The service center, our toll-free number is going to stay the same. It's that 866 Emeriti number. The operating hours for the service center will be 9 to 5:30, and the service center will be staffed by both TA-CREF, Savitz, and Aetna individuals that are trained specifically in the Emeriti program, and they should be able to answer all of your questions. We talked about the enhanced reimbursement benefit, about the fax process and the debit card coming. Online dashboard, this is something we haven't touched on. What this is going to be is a product offered through Savitz. It's basically, you're going to go under the website, log into this dashboard, and get a snapshot of exactly what your account looks like, what the balances are, if you have any balance in there, what insurance plans are available to you, or what insurance plans you've actually enrolled in, and what the premiums are for your specific zip code. as well as giving you a history of any reimbursement benefits that you've already filed, or if there are any outstanding benefits, you'd be able to see what the status of those benefits are. Statements from TA-CREF and Savitz. Currently, through Fidelity, you get one statement a year. Typically, comes the end of January, beginning of February. With our new partnership with TA-CREF and Savitz, you'll be getting quarterly statements to keep you updated on the status of your accounts. And we already just talked about the enhanced menu options that will be coming most likely in the second quarter of 2012. As far as fees go, the fees are virtually the same as they were last year. The Emeriti fee is still $5 while you're working and in retirement. TA-CREF fee is 67 cents, both active and in retirement. The Savitz fees while you're working is $1, and when you retire is $6. And the reason it goes to 6 is because that's really when all of the heavy lifting or transactions are occurring. The premium payments and reconciliation and adjudication of reimbursement claims. Good news is that SPU, during your active years and in retirement, will pick up the entire Emeriti fee for you. So you don't have to worry about that fee. And this is just an example of some of the ways that we communicate with folks. And I think we've pretty much talked about all of these. The service center, enrolling kits that you'll receive before retirement, or you can call the service center and ask for an enrollment kit. Workshops, which is what we're doing currently, and we're out here every year. Website, we've recently enhanced our website. I would recommend going on the website and just perusing around a little, and there's a wealth of information on there that you can gather. The dashboard we've already spoke about. Communications, again, we're able to, with this new partnership, target more life stage communication. So essentially, right from the beginning of employment to retirement, you're going to be able to receive additional communications. And the quarterly statements we just mentioned. That's a lot of information in a very short period of time.
Here, are these slides going to be available on the website?
They can be, yes.
That would be helpful.
Yeah.
Because it's a lot of information.
It's
It
a
is.
lot
It's
of
a lot of
information.
I think I have them.
I think you do. If you don't, I can get them to you.
Yeah.
I know you put them on the website.
I
think
did last year.
You can. They're on the Emeriti website as well.
They are.
Yeah. So all of this information is on there. If you're thinking about retirement and maybe in a different location and want to know what the premiums are, there's a really neat tool. It's called on the website Tools and Calculators, and it's a premium calculator. So you can put in a zip code for anywhere in the country, and it'll show you what the rates are for the plans and show you what's available yeah. So yeah, when you're ready to, all you need to do is call in.
Yes.
And,
I have a question.
Yes.
Between the traditional and the PPO, you said the PPO that they just Aetna picks up. You don't even use the Medicare.
right. So the PPO plan, Medicare Advantage plan, you're literally assigning your Medicare Part A and B over to Aetna.
Right.
Medicare is then out of the picture, and Aetna becoms the primary
Is
payer.
that less complicated or no? Either one, you have a card that you would
Yeah,
at a
yeah,
doctor's
it's less
office?
complicated. It's not any less complicated than a traditional choice.
It isn't.
Right, yeah, they would both be
Okay.
equally as easy to use.
Easy.
Yeah. Yes.
Okay.
Yeah, easy. Didn't you hear easy in this whole thing? So easy, Jackie. Medicare, easy, easy.